This is my presentation for Journal Club number 2. The article that I chose was Vegetarian Diets and Risk of Hospitalization or Death with Diabetes in British Adults, Results from the EPIC Oxford Study. This was an observational study. For the PICO, the population was British adults participating in the EPIC Oxford Study. EPIC stands for the European Perspective Investigation into Cancer and Nutrition. The exposure was a vegetarian diet, a fish diet, and a low meat diet. The comparison was a regular meat diet. The outcome was hospitalizations or death with diabetes. In terms of the meat diets, the regular meat eaters was characterized by greater or equal to 50 grams per day of meat. The low meat eaters was less than 50 grams, and the vegetarian vegan group had 0 grams of meat. Are the results of this trial valid? Is there risk of bias? The comparison groups were similar with respect to important determinants of outcome. In order to isolate the diet groups with regard to diabetes risk, this study used stratification for sex, method of recruitment, and region. Individuals were recruited from 7 regions in the UK. Confounders were accounted for, including socioeconomic status using the Townsend Deprivation Index, education level, demographic factors such as age, lifestyle factors such as smoking and alcohol consumption, physical activity, ethnicity, and BMI. Outcomes and exposures were measured in the same way in the groups being compared. Food frequency questionnaires were used to determine the diet group, which was the exposure, as well as the 15-year follow-up. Diabetes status, which was the outcome, was obtained via health records. The follow-up period was sufficient. Food frequency questionnaires were sent out 15 years after the first survey. Food frequency questionnaires were retrospective, which was based on foods consumed over the past year. As we know, food frequency questionnaires are subject to recall bias, either underreporting or overreporting. The temporal relationship was correct. This was a prospective forward-looking study. Only diabetes-free participants were recruited at baseline. There was not a dose-response relationship since the low meat and the vegetarian vegan groups both had the same hazard ratio. In order for there to be a dose-response relationship, there would need to be a continuous decrease or increase in hazard ratios from the regular meat diet to the low meat diet to the no meat diet. What are the results of the trial? The strength of the association between the exposure diets and the outcome was moderate since the hazard ratios were less than 1, with fish eaters showing the strongest association. So you can see this in the forest plot in figure 1 here. In figure 2, BMI was factored in, and you can see that BMI influenced diabetes risk much more than the individual diets. In the context of BMI, the individual diets did not have much of an effect. So like if you look at BMI of 22.5 to 24.4, you can see that the hazard ratio is less than 1. However, if you look at high BMIs like over 30, even for those following a no meat or low meat diet, their hazard ratio was quite high. Also, the BMI was the only subgroup that had a statistically significant p-value of 0.05. The estimate of risk is fairly precise. In figure 1, the confidence intervals had narrow widths, which indicates increased precision. However, in figure 2, which plots the dietary groups along with BMI, some had wide confidence intervals, so this would lack precision. In figure 2, the lowest BMIs resulted in the lowest hazard ratios, indicating that maintaining a low BMI may be even more effective in lowering the hazard ratio compared to the exposure dietary groups. Can I apply the results of this trial to my patients? The results are applicable to a certain extent. It seems reasonable to convey the results of this study to patients. The fish diet, as well as the low meat and non-meat diets, were associated with lower rates of diabetes than the regular meat diet. Maintaining a low BMI may be an even more effective strategy for lowering diabetes risk. The magnitude of risk. The hazard ratio for the low meat eaters was 0.63, which is 37% lower risk of diabetes. The hazard ratio for fish eaters was 0.47, which equates to 53% lower risk of diabetes. The hazard ratio for vegetarians and vegans, which was mentioned earlier, is the same as the hazard ratio for the low meat eaters. The fish diet had the lowest risk, followed equally by the low meat diet and the vegetarian vegan diet. Clinical bottom line. Fish consumption is recommended since fish eaters had the fewest cases of diabetes of the diet groups. Lowering meat consumption may be just as effective as not consuming any meat at all in terms of diabetes risk. Patients looking to lower their diabetes risk may want to focus primarily on achieving and maintaining a low BMI, then changing their diets to less meat, although consuming a low or non-meat diet may contribute to a lower BMI, which could lower the risk of diabetes. Strengths of the study were that a large sample size was used, which included 45,314 participants. It had a long follow-up time, which was a mean of 17.6 years. Diabetes was also assessed through medical records. Limitations of the study. It's not considered generalizable since it was restricted to white Europeans. The study didn't account for individuals that had well-controlled diabetes through medications and weren't hospitalized for it or died from it. The study didn't distinguish between hospitalizations and deaths due to factors unrelated to diabetes. Family history of diabetes wasn't considered, as diabetes tends to run in families and individuals could be genetically predisposed. Individuals consuming low and non-meat diets may have followed healthier lifestyles, which included additional factors that weren't adjusted for, which could introduce residual confounding. An example is an increase in consuming plant foods and plant protein consumption may have contributed to lower rates of diabetes and not necessarily due to the lower meat consumption. And that concludes my presentation. Thank you.